Happy Monday. I got my cool cat shirt on and I'm ready to bring you the weekly update. Bruce is coming over for his Rejensa treat. Do you want a treat? Here, Bruce, say hi. Here, you want a treat? Good boy. Good boy. Good boy. So I've been talking to you guys a lot about Rejensa. A lot of you have ordered it. You're excited to try it. It's a new improved form of glucosamine, unlike any others that are on your shelves right now. And they're offering great support with your first order. You get starter packs for free to hand out to your clients so that they can try that starter pack before they open the jar. And so I decided to try it on my boy Bruce. And I decided to try it for him for two reasons, actually. Number one, of course, is because I adopted him last year. He is in the age range of anywhere from like 7 to 10 years old. I'm not really sure, but you know, he could definitely use something to keep him feeling his best. But also because I've gotten a couple of questions over the last week if the treat's hypoallergenic. And the answer is that it's got a small amount of chicken meal in it, but dogs with allergies have been shown, or so I'm told by Andrew, the Rejensa rep, to do really well on it despite that. And so Bruce here, he has a very sensitive stomach and itchy skin, and I have to be very careful of what I feed him. He's on a special food, and I have to watch what I give him as far as treats go and things like that. Otherwise, he ends up with diarrhea and itchy skin and ear infections, whole 9 yards. So I decided to try him on the Rejensa last week just to see how he did on it and if it upset his stomach in any way. And we are on day 4. He loves it. It's like a treat. And he's done great with it. I've seen no, adverse side effects as far as, stomach issues go. And he also kind of acts a little bit like an old man when he gets up off of the couch or out of his bed or whenever he's been laying down. So I'll be interested to see if it, makes him a little more peppy. So I will, stay tuned, and I will give you another update after he's been on it for a week or two. So also next up, I wanted to talk a minute about Cardellas. And Cardellas is a new drug from Seva. I've talked about it a few times on the updates. It's for congestive heart failure in dogs. Details of the interview that I did with Dr. Carol Fergus is in the email again. So if you haven't watched it, feel free to do that. It is available for order now. So let me know if you have patients that you want to try it on. Also, depending on the order size, you get a free heart model with a Littman's stethoscope. So one more thing to mention on it too is that Seva is sponsoring a spring cardiology workshop on March 11th. So I put the link to register for that in the email as well if you're interested. Next up also, some of you have emailed about this, and I'm sure that you've heard from your Verbac rep, but Verbac just came out with a new treatment for mast cell tumors. It's called Stelfonta, which is a tiglate injection. And this new molecule basically destroys all non-metastatic mast cell tumors after injection, so there's no anesthesia needed, and naturally heals over the course of 4 to 6 weeks time period. So there's case studies, dose calculators, education modules on the website. I included that in the email as well. I did print this out. I was taking a look at some of their pivotal trials and studies. And again, this is on the website. Basically, it said they took 123 dogs with stage 1A or 3A cutaneous or lower limb subcutaneous mast cell tumors confirmed by fine needle aspiration cytology. The dogs were randomized into 81 tiglate treatment dogs and 42 control treatment dogs, and talks a little bit about the treatment administration and the evaluations. And basically the results said 75%, which was 60 out of the 80 of the treated dogs achieved complete resolution by day 28 compared to the dogs in the control group. And it's at a second tiglate treatment for the 18 dogs that did not achieve complete resolution at that 28-day time period, increased overall response rate to 87% after that second treatment. It also said 96% of the dogs treated had no local reoccurrence of disease 84 days after the treatment. The most frequent adverse effects were reactions at the treatment sites, and it said 92% of the dogs treated developed wounds that healed rapidly from day 7. So pretty cool. There's some studies, like I said, on the website that you can check out. Let me know if you want to talk more about that. Also wanted to mention, I mentioned on last week's update as well, to check out our Pivetal brand. The link's in the email. and I can always bring you a hard copy of the catalog. Prices are great, so if you want to consider switching from some of your name brand things, sutures, white goods, things like that, there's a guarantee on everything you order, so it's definitely worth trying. Also wanted to mention, if you spend $3,000 on Pivetal brand fluid therapy products over the next couple months, you do get a free otoscope. So I did attach a flyer with all the products listed in that attachment if you want to check that out. Also, MERCK price increase is happening on April 1st. So definitely get your orders in now. They also have a promo going on. If you buy 6 trays of the Novavax vaccine, you get 1 tray for free, and you can mix and match those vaccines. Last but not least, I wanted to mention some of our technology options. So one thing I wanted to mention is actually because one of our customers, one of the doctors that I speak with last week, I had dropped off our Insight magazine, and she texted me right after. She had read some of the articles in it, which I thought was great. And one of them that she was interested in was this Client HQ, which makes your calendar into a smart calendar, where you can text, email, send pics right from the schedule, and it's seems super convenient for that curbside care and creates a better experience for the client overall. So I thought that was cool and something to mention. If you guys want to check that out, I put a link in the email. I also wanted to highlight our Vet Success technology, that gives you a daily dashboard, practice health indicator reports, an email program. I know it's a new year and great time to explore how to be more successful and organized than you were last year. It also technology like this will allow you to put more money back into your hospital, into your clients' care, and also into your staff with these types of tools. So I did attach the brochure for our Vet Success. Also, if you're part of our Patterson rewards program, you might have some technology credits that you can use towards our software options. So we can definitely explore that if you want me to check into that for you. Otherwise, that is all for this week's update. Thank you for watching. Of course, let me know if you have any questions at all, or if you'd like me to stop by this week. Otherwise, have a fantastic Monday and a great first week of March. Thanks.